Hello, my name is Julio Montaner. I am the Executive Director and Physician-in-Chief of the BC Center for Excellence in HIV/AIDS. This year marks the 30th anniversary of the BC-CfE. In the last 30 years, we have accomplished quite a lot. We have pioneered a life-changing HIV treatment and subsequently built on this experience with the development of the Treatment as Prevention Strategy, which we also know as TASP. In 2015, our TASP-inspired 90-90-90 by 2020 target was formally adopted by the United Nations and unanimously endorsed by all UN signatory countries, including Canada, as the roadmap for the global control of HIV/AIDS. Based on our original design, in 2020, the United Nations replaced the 90-90-90 target with the 95-95-95 by 2025 target to continue the global effort to eliminate AIDS as a pandemic by 2030. I cannot think of a comparable Canadian success story in the realm of global public health, and I want to take a moment to heartfully thank everyone that has contributed to this impressive success. Especially, I want to honor our patients who over the years have contributed so much to our research. Similarly, the government of British Columbia for their unwavering support and encouragement over the 3 decades. Our staff at the BC-CfE for their continued commitment to delivering the best evidence-based programs to those in need here, in the rest of Canada, and abroad. To our beloved St. Paul's Hospital, where we started this work almost 4 decades ago. To our academic partners, the University of British Columbia and Simon Fraser University, as well as our 5 health authorities who critically support the work of the BC-CfE throughout the province. And our funders, from CIHR to the National Institute of Drug Abuse at the NIH, from Genome BC to Genome Canada and the Michael Smith Health Research Foundation, we are grateful for their support. Last and not least, our philanthropic donors, most especially the 620 Power Foundation, for the tremendous support and encouragement over so many years. In BC, we are well ahead of schedule to meet the 95-95-95 target, and as a result, we have seen remarkable decreases in HIV/AIDS related morbidity and mortality, as well as HIV transmission. In this regard, we have made major inroads, expanding the reach of our TASP-inspired work to related epidemics, including the opioid use disorders epidemic, the hepatitis C epidemic, the COPD epidemic, and the diabetes epidemic, among others. We have trained generations of practitioners and researchers. We have challenged stigma. We have fought and continue to fight to remove barriers to care for all. And in doing so, we are pioneering new systems of care, particularly at the Hope to Health complex in the downtown east side. While there remains much work to be done, we have come a very long way since our beginnings in 1982. And in the weeks to come, we want to reflect on this legacy. We will tell the story of how BC transformed from the epicenter of the HIV epidemic in Canada back in the day to a global leader in HIV care and prevention. We will hear from those responsible for this work through a series of videos, blogs, and in-depth conversations. Please join us in celebrating the people who have made 30 years of excellence a reality. Many thanks.